Hey everyone, it's been 4 weeks now, a little over 4 weeks since my surgery, and I just wanted to give a quick update on how I'm doing. Doing really well. Nothing really has changed since my last update, except my neck's just feeling stronger and better every day. One thing that's really encouraging is, so yesterday, I've just noticed that my neck it's been stiff, obviously because I've been wearing a collar pretty much 24/7 for a number of weeks now. Not to mention I've got a bunch of, titanium in there as well. Yesterday morning after my exercise walk, when I got home, I made the decision to not wear the collar, the soft collar. So long story short, when I was discharged from the hospital, before discharge, the nurse practitioner that discharged me gave me instructions, went through them, and in those instructions it said I can wear a soft collar when sitting, as well as sleeping. Thank goodness. I mean, that's so much better than a hard collar sleeping. I feel for you folks out there that have to wear those all the time for 6 weeks, some more, some as long as 8 weeks. So I'd been doing that, following that, but I'm finding that the more I move, they also say don't put your arms above your head and all that. The more I'm moving the last few days, I'm less stiff. I'm feeling stronger and better. I just think I'm an edge case as far as the healing process. I haven't had pain. Hasn't been an issue at all since I woke up. So I'm at a point where I'm going to not wear the collar as much. I'll wear the soft collar throughout the day. I'll wear it whenever I think I'm in an environment where I could possibly, in the house, where I could possibly, be tempted to move my neck too quickly. Of course, when I leave the house, which is basically just, the occasional trip to the grocery store if I can get a ride, or every day I walk about minimum of 4.5 miles to a local gym with an indoor track. I'll do a walk there and then walk home. That I'm absolutely will wear the hard collar. It only makes sense. But at this point, I'm going to work on a little bit of mobility and just small movements I'm fine with. And I'm already seeing a huge difference. It just feels more normal and stronger. Again, small movements, nothing crazy here. Incision, you can see it. I'll zoom in on the video there so you can see I'm fine with it. I know it's large. Feels like it's like or not feels, but looks like it's drying out a little bit there. I was not given any instructions to put like ointments or anything like that. In fact, I think when I last read over the discharge instructions, it said don't put anything on it. And I'm fine with that. I'm not going to go, I know it's common to go putting vitamin E and all these things on it. I'm not so vain. I don't really care what it looks like long term. I just care that it's not gotten infected and doesn't look like it's causing an issue. So I think it's good to go. I'm able to shave, even shaved a little over it, I think, today, and it was no problem. So I'm good there. I'll wait till my 7-week appointment to ask about, should I put anything on it to make it fade out, faster or better. As far as symptom relief, left side has it feels like it's all cleared out. Like I no longer get any numbness in my fingers on the left side. I was getting a little bit about the month or two before surgery. It started to finally hit my left side. Those are all gone. That's gone. Left side feels completely normal. About 2 months before my surgery, my left foot started dropping, meaning I would go to walk and the first step with the left foot, it would not go. It would just drag, and then it would start. It was like a delayed response. Very scary, but I was okay with it. I didn't freak out because I knew I knew surgery was going to be in time, and that's been completely fine. In fact, if anything, my legs feel a little lighter. I think I've mentioned this in the prior videos. My legs feel super strong. And that's a question I have for my surgeon at my follow-up is it because my brain was sending signals to it to move, to my legs, to my lower body to move, and only a small portion was getting there? Or is it because possibly there's still a little numbness in my legs? I just don't know. They don't feel numb. I feel everything, when I touch the side of my foot, just to check, and they feel perfectly normal. So I'm hoping and thinking it's the former, that it's just the signal wasn't getting to them before, so they felt heavier as a result. Who knows? I'm thrilled with the outcome. If I get no more symptom relief's not the right word, correction, a reversal of the degradation that I had. If I get no more, then I would still consider the surgery a success. The right hand, still these 3 fingers, there's some numbness. This one, it's lessened quite a bit, but that one didn't start getting numb, I don't believe. It's hard to really assess yourself with this stuff. I don't believe it was until maybe the 6 months prior to surgery where this one started going numb, the middle finger. The index and thumb were numb for many years, about 8-9 years before. I don't expect those to come back, but as I said in a prior video, they do feel different. And I've noticed in the last week or so, since the last video I posted, there have been times where I've gotten most of my feeling in this finger back and some of it in this. So I think that's a positive sign. Who knows? It's going to take a year, if not longer. But after a year, we'll know, and it'll be fine either way. Bruising so the IV, this is not something I was expecting. If you remember my last video, I had bruising from like here to here. It was really dark and bad. You can see there's just a small, still sizable, but there's a small portion left, and I don't think you can see it in the video, but you can see the little stick, the red spot there. It's a little surprising, but not surprising that it's been 4 weeks and I still have bruising from the IV. But it's going away slowly but surely, so I'm not too alarmed with it. Last week, I did drop a glass, and I'm not sure if that was, those of you that have cord compression myelopathy, it's one of the things that scares the living daylights out of us, and one of the reasons we have to get this thing corrected. Prior to my surgery, especially the 3 months or so prior, I was dropping glasses like once a week, dropping things all the time. Basically you would I'll just give an example. Go to grab something, and immediately you would, without intending to, you just drop it. Those of you that don't have that issue yet. I'm not doing that since surgery. There's never a go to grab something and immediately let go. It is grab something and just tap it again, turn and taps it again, because you can't move your neck, turn and it lightly taps against the counter or something, then it drops. That's happened 3 times, all within around a 2-day period last week. And one of those things was a glass. That's a setback. That's concerning. But that was, I guess, about a week ago, and maybe 5-6 days ago, and I haven't noticed any of that since. So I guess my point there is there's all kind of weird stuff happening, but it's all very subtle, and with nerves and such, regenerating and changing. And so things are happening. I think progress has been slow but steady and good. So that's that. That's the update. Doing well. This video is way too long. I'm going to cut it down. I'm at 20 minutes here. That's just too much. I'm going to cut some chunks out. And I wish you well. Stay positive. Keep moving. If you've gone through this and you're in recovery, keep moving. Can't tell you enough. Not your neck so much. Don't take my advice on that. Wear your collar, but walk. Walk every day as much as you possibly can. Push yourself a little bit. You got to. There's a difference between pain and discomfort. It's a big difference. So that's my advice. Take it for what it's worth. Not much. I'm just a clown on YouTube with too much time on his hands because he can't work and has just had surgery a month ago. So best of luck. Stay positive, and I wish you the best.